Oh, advice for administering medications. So the first time is going to be the scariest. It's a unique situation, right? You're giving yourself an injection. Not everybody has done that before. So be kind to yourself, be patient. Once you get the first one done, the rest will come at ease. And if you need support, there's always support. You can give us a call. We'll help walk you through everything.
My advice for administering medications is it can definitely be scary if you're not in the medical field, if you don't have any experience, but there's great resources out there. We will always try and provide as much information as we can to help, and confidence is key.
So we have lots of video resources that we can send the patients, a lot of online video tutorials that you can watch ahead of time, and you're also more than welcome to schedule a consult with your nurse to come on in and we'll show you personally how to do those injections. Yeah, so there's a lot of rumors about what the potential side effects are with fertility medications, but essentially you are going to feel a little bit uncomfortable, a little bloaty, but it's for a short span of time. So really you just got to monitor how you're feeling. If you're having something, out of the norm, such as like an extreme headache, that's usually like the biggest complaint is like the headache or blurred vision. Definitely reach out to your team so we can help advise you on your next steps. Oh, so signs that are concerning during treatment, so like an emergency call. Definitely heavy bleeding is the biggest one, especially, depending on where you're at with your monitoring, but heavy bleeding when we're seeing heavy clots, soaking a pad in an hour and it's consistent for 2 hours, definitely give us a call. We're gonna direct you to urgent care ER at that point. If you're starting to have any welts in an area where an injection or a patch may be, let us know. That could be a little bit of an allergic reaction, which is typical with some of the adhesive of the patches that we use. It's just a matter of changing the medication protocol or the medication itself so that we can get you a new one.